Our next paper will be Evidence-Based Medicine versus Experience-Based Medicine in Plastic Surgery, the role of closed suction drains in plastic surgery. Dr. Shridharani. Thank you.
Yes, sir. Good morning. Thank you very much for giving me the opportunity to present evidence-based medicine versus experience-based medicine in plastic surgery, the role of closed suction drains. My name is Sachin Shridharani. I'm currently a chief resident at Johns Hopkins in Baltimore. I have no conflicts of interest or financial disclosures to report at this time. The utilization of closed suction drains in the immediate postoperative period is incredibly well described to try to decrease pathologic fluid collections. Hematomas and seromas can be a devastating complication for the patient and, of course, a massive concern for the surgeon as well. Certainly one of the challenges in aesthetic surgery is managing patient expectations and minimizing complications. It's not uncommon to try to do everything that we possibly can to decrease these pathologic fluid collections as they can cause major problems. At this time, however, there seems to be an ongoing debate in the literature whether, in fact, these drains do, in fact, what they're designed to do, and that is decrease those fluid collections such as seromas and hematomas. This seems to be an area within plastic surgery where the experience or anecdotal type of thoughts that we've had can, in fact, be challenged by the evidence that is available. In particular, within aesthetic surgery, it seems that the main areas where there are concerns for seroma and hematoma formation can be within facelift surgery, abdominoplasty, and breast reduction. And there seems to be good data in these different arenas or anatomical sites. So the aim in particular was to try to elucidate or negate the indication for closed suction drain placement in multiple plastic surgery procedures, and also see if in fact there is evidence to, compare that to the experience or what individuals report by evaluating an international survey and domestic of all members of the ASPS. So a systematic review of the literature was performed by searching the 4 top and largest scientific search engines and databases, and the mesh search terms are listed here. The search generated all of the relevant studies that were included and independently evaluated by 3 reviewers. 100% agreement was found for inclusion. Inclusion criteria also was level 1 and level 2 studies and large retrospective reviews in order to maximize the yield of high quality studies to draw some type of conclusion. Case reports, cohort studies, and smaller reviews and non-English journals were excluded. As far as the survey component is concerned, all members of the ASPS, both domestically and internationally, were given an electronic survey. They were allowed 6 months to complete the survey and given intervals at which they were given reminders as well. It was, this survey was comprised, of multiple plastic surgery management issues, so it was approximately 30 questions. The yield from the systematic review initially was 590 studies. They were all critically evaluated, and after application of the inclusion criteria, 83 remained. After application of the exclusion criteria, 18 high-quality studies remained. As far as the survey itself was concerned, nearly 5,300 questions were distributed or disseminated, and approximately 700 plastic surgeons responded. When posed with this question initially, which was, what procedures do you perform that you routinely feel patients are at increased risk of developing a seroma, 90% of individuals felt abdominoplasty, nearly 15% for breast reduction, and almost 10% for facelift surgery. When asked if you routinely place closed suction drains in patients that are at a high risk of developing a seroma, over 90% of respondents of the ASPS felt that placing drains would be helpful in decreasing seroma rates. When asked directly about abdominoplasty, 90% of individuals felt that placing a closed suction drain would in fact decrease their seroma rates. And while this thinking is correct, if we critically evaluate the literature, drains do decrease seroma rates in abdominoplasty when compared to non-drains groups in prospective studies. But progressive tension sutures, or the utilization also of quilting sutures, dramatically and statistically significantly also decrease the overall incidence within those procedures. Furthermore, when posed with the question regarding breast reduction surgery, almost 30% of individuals felt that placing a closed suction drain would in fact decrease the overall incidence of seromas. Critical evaluation of the literature shows that even with large volume reductions of nearly 1 kilogram per side, there does not seem to be any evidence to support placing closed suction drains to decrease seroma rates in breast reduction surgery. Again, critical evaluation for facelift also has shown that there is slight reduction in the seroma rates. However, this was in 2 large retrospective reviews. Prospective randomized controlled trials would in fact be warranted to try to come up with a consensus answer. Furthermore, the overall incidence of seromas in facelifts is significantly lower. So that in itself was an area where we felt that there was definitely room for larger and higher quality studies. When asked the same questions about hematomas, it seemed that abdominoplasty patients, the response rate was approximately 50%, 71%, and 40% for abdominoplasty, facelift, and body lift, respectively. Over 50% of respondents placed closed suction drains in an attempt to decrease hematoma rates, which was interesting. And when asked directly about abdominoplasty, almost a quarter of respondents felt that placing a drain would in fact decrease hematoma rates. And when you compare this to what the evidence shows, there is no evidence whatsoever to validate that finding that drains in fact decrease hematoma rates in abdominoplasty. Drains also have not been validated to decrease complications with regards to hematoma rates in a breast reduction, yet 20% of respondents, or nearly 20% of respondents, felt that that would be the case. And again, in looking at facelift surgery, in which hematomas are the highest, most common complication for that type of procedure, 20% of individuals felt that placing a drain would decrease their hematoma rates. The evidence does not support that finding as well, and in fact has only been shown to decrease the appearance of ecchymosis in the short-term period. What this tells us is that we have room for best practice guidelines that we can certainly apply in the plastic surgery literature as we hold ourselves to a higher standard and not necessarily employ unnecessary foreign bodies that carry their own morbidity associated with them. Thank you very much for the opportunity to present.